Hello, my name is Hamilton Barber. I am a healthcare attorney at Next Pruitt, and I focus my practice primarily on healthcare regulatory compliance and reimbursement. The emergence of COVID-19 brought with it many changes to our way of life. One constant through it all has been bad actors trying to use and using the COVID-19 public health emergency to perpetrate healthcare fraud. Of the $3.7 trillion the federal government has spent on COVID-19 relief, the Department of Health and Human Services has dispersed to providers more than $150 billion from the Provider Relief Fund. Such massive amounts of COVID-19 relief are an attractive target for these bad actors. The federal government this year has directed much of its fraud and abuse law enforcement activities at COVID-19 healthcare fraud. It is no surprise that much of this enforcement activity has focused on clinical laboratories, as the COVID-19 pandemic led to an unprecedented demand for diagnostic laboratory testing. For example, Medicare Part B spent $1.5 billion on COVID-19 tests in 2020. Examples of COVID-19 fraud allegedly perpetrated by clinical laboratories include paying illegal kickbacks and bribes to marketers for referrals of COVID-19 tests, bundling COVID-19 tests with medically unnecessary and expensive tests, and paying kickbacks and bribes to obtain the doctor's orders for such medically unnecessary tests, offering COVID-19 tests as a way to obtain personally identifiable information and saliva or blood samples to use in the submission of false or fraudulent health insurance claims, or obtaining a Small Business Administration Paycheck Protection Program loan by fraudulent means, such as through the use of false information. Any clinical laboratory engaging in any of those fraudulent activities should seek out legal counsel immediately. The federal government has a number of civil, criminal, and administrative tools that can be used to address COVID-19 fraud, such as the False Claims Act, Civil Monetary Penalties Law, Anti-Kickback Statute, Eliminating Kickbacks and Recovery Act, Physician Self-Referral Law, and the Exclusion Statute. These laws can have a devastating impact on individuals and businesses, as it can result in jail time or very large criminal or civil fines. Clinical laboratories should therefore adopt, implement, and enforce robust compliance programs to lower their risk of violating one of those federal laws, which could carry penalties in the millions of dollars, imprisonment, and a number of administrative penalties. Please connect with the healthcare team at Next Pruitt to learn more about how we can assist with and answer questions about your healthcare regulatory compliance needs.